Hi, this is Dr. Emily Kubat from InspireLifePT.com. Today we're going to go over some exercises to do in the first 1 to 2 weeks after breast surgery. And breast surgery, we can be talking about mastectomy, lumpectomy, and with or without no dissection. So it's a good idea to talk to your surgeon, your physical therapist, to see what your restrictions are after surgery. Some common restrictions are no lifting more than 5 pounds and no pushing and pulling. So it's a good idea to make sure you know what those are and how long you have to keep those restrictions so that you're comfortable moving forward with the movement. Sometimes I see patients who are really scared to move, and so they don't move much and they get really tight in their shoulders and across their chest. And then sometimes I'll see patients who are doing a little bit too much and need to be reined in. So make sure that you're comfortable with what you're allowed to do and asking specific questions. So it's a good idea also to keep your shoulder flexion nothing over 90 for the first couple weeks. They say in the first 7 to 10 days is when most of the lymphatic regeneration happens. And you can also decrease your risk of seroma formation, which is some extra fluid that can kind of pocket that might need to be drained. So it's a good idea to keep those things in mind, kind of keep all your motion in this area, but make sure that you're moving around. So we'll go over some exercises for you to help make things easier and keep you loosened up. All right, so for these first exercises, it's really important to just keep your shoulders moving. It helps so you don't get too stiff. So most women and men who have surgery tend to kind of, when they're hurting in their chest, they kind of tend to slouch forward, and that can make your pecs really tight and start to cause more pain across your chest when you start to do more activity. So it's really important for you to sit up with nice, good posture. And one way to kind of help your shoulders relax while you're doing that is to do some shoulder rolls. So I tell people, make sure that you're not straining in your neck while you do this. It should really just be kind of a gentle shoulder movement. And you can do them bigger if it feels better, or smaller if it feels like a little bit too much pulling in your chest for you. So you just do about 10 of them. You can roll forward a little bit if you want to too, but usually I just have people kind of go backwards like this. And that's a good one to just kind of keep loose in your whole upper body. And then the next one that I like to do is an upper trap stretch. So you just lay your head over to the side. You should feel this good stretch right in here. And hold for about 30 seconds. Just really let it stretch. Same thing on the other side, okay? That'll kind of help keep that area loosened up. A lot of people tend to get tight there when they're stressed out, and usually after you have surgery is kind of a stressful time. So making sure that you are stretching that out. And all of these you can kind of do throughout the day. They don't all have to be done at the same time. Just if you're feeling real tight in your shoulders and your neck, do some shoulder rolls, do some neck stretches. So the last one that I like to do in the sitting position, you could also do this standing if it's more comfortable for you. It's just to take the arms up here. You're gonna stop when you're at about 90 degrees front and then to the side. I like to kind of keep everything under here. Usually the surgeons will tell you if you have drains in, not to go above 90 degrees anyways. We don't want to be pulling anything too much. Research has also found that the first 7 to 10 days is kind of when the lymphatics tend to regenerate, if they're going to, in the whole area where you've had surgery. So it's important not to be stretching too much. So usually for the first 1 to 2 weeks, you want to kind of keep it down here. You can definitely still be doing most of your activities of daily living, because those are kind of, in here. You might need some help doing your hair, other things like that. And if you don't feel like you can go all the way up to 90 degrees, going a little bit farther down is fine too. It just helps to be moving, continue to be mobile, so that those shoulders don't get too tightened up. Okay, so for this next exercise, it works well if you lay down. You can lay on your bed. If you feel more comfortable, you can lay down on the floor, but I'm guessing most of you would rather lay on your bed. Pillow behind your head. The first one is going to be some diaphragmatic breathing. We have a lot of lymph nodes in our abdominal area, and so besides being good for relaxations, it's also good to stimulate the lymph flow to just relax and do some breathing. So what's different about this kind of breathing is you really want to fill your stomach up with air versus your chest. So you take a real deep inhale in, make your stomach as big as it can be, and then breathe out. So when we breathe in, we think about making our belly as big as it can be. And then breathe out and then have that, you know, more of a flat belly. So that's going to be our first one. Then the next thing you're going to do when you're laying here is you're going to put both hands behind your head. And I'll show you a modification in a minute of a way you can do it if you can't quite get your hands up like this yet. But you can have your hands up like this, and if it feels good, you can just kind of lay here and let it stretch. You'll feel some stretching in your armpit and possibly down your sides, maybe into your chest a little bit. So you can just lay here, relax. If you need to take some of the pressure off, you can kind of bring your arms up like this and then bring them back down, and do that a few times. Now, if it's too much for your arms to be back like this, you can grab some pillows to have on either side. I'll put this one over here. And you could do 1 pillow, 2 pillows, kind of whatever. You might even need to have someone help you put the pillows there, depending on how you're feeling. And then you can just kind of relax on the pillows so you have some support for those upper arms. So that's a good one. Another variation of this is to put your affected arm, whatever side you had surgery on, just lay it out flat like this and kind of let it relax. And same thing with this. If this is too much for you, you can go ahead and put the pillow underneath the whole extended arm and leave it like that and just let it stretch some. So try to do some nice deep breathing, really relax while you're doing this. It should feel like a comfortable stretch, nothing too strenuous, straining, and it's just a really good way to kind of jumpstart that stretching and make sure that your motion doesn't go. So I hope this video was informative for you and will help you get moving after surgery, help you know what kind of things to work on. So thanks for watching, and make sure to subscribe to my YouTube channel and follow me on Facebook, Twitter, and at inspirelifept.com.